I hope she would agree with me when I say that our health and care systems would be overwhelmed if it weren't for the work of unpaid carers in our society. Now, 4 out of 5 of unpaid carers have taken on more caring responsibilities during lockdown, and almost 2/3 have seen their mental health worsen during the pandemic. Many of them have lost their access to respite care. This has also impacted on their ability to earn money, and she'll be aware that the carers' allowances is pitifully low at £67 per week. But one of the things that would help respite care, day care centres to reopen, such as HomeLink in my constituency that's desperate to reopen and taking all sorts of safety measures, would be access to regular testing. Now, I raised this in this chamber with the Secretary of State for Health on the 7th of July, and he told me there was a plan in place and he was going to write to me about it. He never wrote to me. However, I didn't chase him on this because I then heard that testing had been made available to day centres briefly. I've now heard again that this is no longer available. My council has spoken to Department of Health and Social Care colleagues, and they're saying that they're not able to offer respite care to day centres. And this, as this is an issue for her department, I would ask her to urgently address this issue, because that respite care is a lifeline to so many unpaid carers. And I would also ask her to speak to her DWP colleagues to look at whether they can address the woeful level of carers allowance. How can anybody be expected to survive on the equivalent of £1.91 per hour?